faucet for interns, and I want to enter. My name is Miss Green. We're listening to this today. Before I get started, I'm going to go wash my hands. Okay. So first, I'm going to turn on the faucet. I'm going to rinse my hands. I'm then going to lather my hands with soap. And then I'm going to scrub underneath my fingernails. Then I want to rinse. I'm going to do that for at least 20 seconds. Then I'm going to dry my hands. And then I'm going to turn off the faucet. And then I'm going to begin my next skill, which is denture care. I'm going to first apply soap. Apply paper towel to the bottom of the sink to prevent any damages to the denture. Then I'm going to put on gloves. I'll try to undo this. Okay. So then I'm going to, after I put on my gloves, I'm going to turn on the faucet. So then I'm going to take the toothbrush, wet the toothbrush first. Then I'm going to place toothpaste on my toothbrush. So then I'm going to take my dentures, then I'm going to rinse them before I begin to brush them. Then I'm going to begin brushing all surfaces of the teeth. Okay, after I brush all surfaces, I'm then going to rinse my toothbrush and place it in a designated dirty container, and then I'm going to then rinse my teeth. Okay, then I'm going to, after that, I'm going to fill my denture cup with warm water, and then I'm going to place my dentures in the cup. Make sure that it's stored safely. Then I'm going to remove my dirty linen with my paper towel from the bottom of the sink. And then I'm going to dispose it. And then I'm going to remove my gloves, wash my hands, and go back to my unit. So now that I'm back at my unit, I'm going to knock on the door, call for and then I'm going to enter my name is Green. Today I will be providing you with 3 repairs that will help you. So first, I'm going to close the door, pull the curtain. Then I'm going to wash my hands, put on gloves. And then I'm going to elevate my bed to the correct working level. Check the temperature of the water. Is that okay? Okay. So, and so, okay, so then I'm going to begin exposing my patient. Then I'm going to find my underpants. So I'm going to take a towel to place underneath my patient, so she doesn't not with the bed. So I'm gonna begin with lather the rag with soap. So then I'm then going to start wiping from front to back. Front to back. Using different parts of the rag. And then I'm going to rinse. Using different parts of the rag. And then I'm going to dry. Okay, and then I'm going to go back to the rectum area. Make sure I clean that. Using different parts of the rag. And then I'm going to rinse. Using different parts of the rag. Okay. Then I'm going to dry my patient. Then I'm going to put my patient back in correct body alignment. I'm going to then make sure that my posture is. Then I'm going to make sure that the bed is at the lowest level. I'm going to remove my dirty linen, and then I'm going to dispose it. The hamper is in the kitchen. And so then I'm going to go over to the bathroom. I'm going to dispose my dirty linen. Then I'm going to go over to the bathroom and wash, rinse, and dry my basin. So now, we're going to go to the bathroom. We're going to empty my basin. We're going to rinse it. Okay. And then we're going to dry my basin. Okay, so now when I'm done with that, I'm going to place my containers back to the designated unit, and then I'm going to remove my gloves, and I'm going to report any abnormal report. Now I'm going to return back to my unit. I'm going to knock on the door, pause for enter, and my name is Green. You are Miss Williams, and today I will begin checking your respiration. So I'm going to elevate the unit to the correct working level. Then I'm going to assist my patient out of the bed. I'm going to ask her to sit up for me and just sit on the edge of the bed with her feet uncrossed and just relax. Then I'm going to find her pulse. Okay. Let me just reset the timer. So then I'm going to cross her arm, and then I'm going to count for a full minute. So I got 17 respiration.
Correct.
And so then I'm now going to assist my patient back in bed. I'm going to make sure that the possible is in reach. Make sure that the bed is elevated towards the lowest level. Okay, so then I'm going to report any abnormal reports. So after I report any abnormal reports, I'm going to knock on the door, pause for answering, then I'm going to answer. My name is Miss Spring, Miss Williams today. I'll be meeting you today, is that okay? So first, what I'm going to do is I'm going to elevate the bed to the correct working level. And so I'm going to ask my patient to state her name for me to make sure that I have the correct food trace. Okay. So then after that, I am then going to place my table, place the bedside table over the patient. Okay. And then I am then going to start off by wiping my patient's hand. So I will then begin feeding let my patient know what she has today. You have some mashed potatoes with some apple juice. So I'm going to also alternate between the solids and the liquids. So first I'm going to offer my patient some mashed potatoes. I'm going to also watch my patient chew and swallow. Give her time to swallow. Would you like any more mashed potatoes or would you like any more apple juice? Okay. Would you like any more mashed potato? Okay, so then after that, I'm going to wipe my patient's hands again. Then I will clean around her mouth. After that, I'm going to dispose the paper towels. Place my chair back. Then I'm going to remove the bedside table from my patient. Then I'm going to leave my patient sitting up, make sure that her call signal is in reach to let her food digest. After that, I'm going to wash my hands before and report any abnormal reports. Then I'm going to go over to the oxygen tank. And then I am then going to change the oxygen level from 8 to 6. And after that, I'm going to wash my hands and report any abnormal reports.